Vatsala, KUNWAR.
Good afternoon, everyone. The topic for my presentation is a misdiagnosed case of optic disc pit maculopathy. Optic disc pits are considered as part of a spectrum of congenital cavitary anomalies of the optic disc. They are rare and occur equally in men and women with an estimated incidence of 1 in 11,000 people. Optic disc pits, ODPs, are usually single, oval-shaped depressions at the optic disc. They are most commonly found at the inferotemporal aspect of the optic disc, but may be found elsewhere too. Optic disc pit maculopathy is a term used to describe macular changes that occur in context of an optic disc pit, which include intraretinal and subretinal fluid accumulation and retinal pigment changes causing visual deterioration. Case details. A 19-year-old student presented to RIMS OPD with the chief complaint of diminution of vision in the left eye for 2 years, watering for both eyes since 1 year. History of presenting illness. My patient was apparently well 2 years back when he noticed diminution of vision in his left eye, which was gradual, progressive, and painless. No history of type 1 diabetes, hypertension, trauma, COGS, asthma, foreign body, and night diminution of vision was seen. For this complaint, he visited a local practitioner where he was diagnosed with left eye CSCR. For this, he was prescribed lifestyle modification, topical medications, and 1 year ago, he also received 3 anti-VEGF injections, but he didn't get relief. So he visited RIMS OPD for the same complaint. He has no significant past medical or surgical history, no significant family history. Personal history, the patient had adequate sleep for 8 to 9 hours. Patient is on mixed diet, regular bowel and bladder movements, no conflicts between family members. General examination, where he was average in build, fair in nutrition. Systemic examination, everything was within normal limit. Ocular examination, in the right eye, the visual acuity was 6.6, whereas in the left eye, it was 660, and the BCVA was also 660. Rest, everything was within normal limit. On fundoscopy, in the left eye, the media was clear, the optic disc was vertically oval, cup disc ratio was 0.3, pink in color, grayish spot seen temporally at the disc, suggestive of optic disc pit defect. The foveal reflex was dull for the left eye, and a round, well-delineated, localized serous macular detachment was seen. Rest, everything was fine, and the right eye was also normal. This is the fundus photograph. So my professional diagnosis is left eye optic disc maculopathy. The investigations were done. The patient was advised for the treatment, but the patient refused the treatment and was lost to follow-up. This was the OCT of the left eye. The fact that optic disc pit maculopathy is a rare disease with the prevalence being just 0.1% is the unique thing about my case. ODP-M can be misdiagnosed if the optic disc is not examined properly. Clinical implication, patients with ODPs that are diagnosed incidentally should be counseled on the risk for development of ODP-M. Although rates vary from 25 to 75% and there is no known trigger for it, patients should be encouraged to return for examination in any case of visual deterioration in the affected eye. One should always do a detailed examination of the optic disc. Limited vitrectomy with intraretinal fenestration is a recently described technique. The most important issue is to discuss the ODP-M patients in whom surgery has been recommended is that the visual recovery is a slow and long process. Thank you.
So very well presented. For all the students present here, so probably it was, this patient was seen outside, in some outside center. Somebody gave 3 anti-VEGF injections to this patient. I mean, it's quite sad, honestly.
Yes,
very
sir.
well presented advice.
Thank you, sir.